Hello everyone. We welcome you to the today's session of I had two miscarriages. What do I do? From Apollo Fertility. To speak on this topic today, I would like to welcome our Dr. Nikita Lad and Patel. She's an in-house infertility consultant associated with Belapur Center in Navi Mumbai. She has done her MBBS DGU. She's a gynecologist. She has done her fellowship or postgraduate in infertility from London University and fellowship from Mumbai University. She's a well-known infertility specialist associated with Apollo Hospital. I welcome you, doctor, to talk on this topic. We all are looking forward to know more about what is to be done, what things should be taken care of. The session is all yours, ma'am.
Thank you. Good afternoon, everyone. I'm Dr. Nikita. I had the Apollo Fertility Navi Mumbai, and as when patients come to us with having history of two miscarriages, it's very tough for all the patients. It's not an easy thing when you get pregnant and you lose a child. It's very emotionally bonding, and as you know, it's very tough. Even why? What is the reason? Always the patients want to know what was the cause of a miscarriage. So remember, what happens mostly in the first miscarriage or missed abortion, we do not do many tests. But when you go ahead with the second one, emotionally you are totally lost because and you broken down thinking about why the second time. So sometimes nowadays we do not wait for a second miscarriage. It's better that even if you have a missed abortion in the first time itself, you can go ahead with something called as we test the karyotyping material microarray of the tissues of the baby, of the embryo inside. So when there is a missed abortion, when you have bleeding PV, when you're pregnant, when you go to a gynec, they say no, on the sonography there is no heartbeat or you cannot see the baby's growth. When this is a situation and you're lost, of course you're emotionally drowned, and you have to know what to do next. So before you plan anything, thinking that okay, this is the first cycle, sometimes you can talk to your gynec and tell them, I would like to know what was the cause itself in this situation this time. So in that play, what we do is we remove the tissue, we send the tissue into a lab, a genetical lab, which will show us and tell us what was the cause. That's really important to know. And we do some blood test, extra test on you to know, are you having an auto antibodies like APLA, SLE, any blood disorders? Are you married to some relative in your family? These are the common causes which mostly we see the causes of abortion. Secondly, the most common, you see sometimes infection in the uterus, or the egg quality or the embryo quality is weak and the embryos just fall off. Mostly the aneuploidies, we call it, that is in the first trimester, whenever you have an history of abortion. That is, we say, the cause maybe there might be some trisomy 21 or 18 in the embryo. That is the cause where the embryo had some abnormality, and that is the reason you're having an abortion. So God is great, there is something which, if there is an unhealthy embryo inside your uterus, it will make sure it falls off. You do not go through the whole process of holding on 9 months to an unhealthy embryo. So these are all other options, and we have to figure out, what was the reason. Sometimes even simple uterine infection, we see endometrial infection, which causes the abortions. Semen infections, they do not go till abortions, but embryo quality, if it's weak, it will go. So remember, the cause can be a uterus, any infection, egg quality, embryo quality, semen infection. You have to do a DNA profile of the sperms. If the female is drinking, smoking, you need to stop that during pregnancy. So these things have to be planned. You have to know what was the reason and how do you manage it. Now, management, see, diagnosis, once you missed your, some people, what, they know at their period date exactly if they're coming in 28 days. They do their blood, they do their urine test, it comes positive. Within 2 days it bleeds, and it keeps happening. This is called something called as a chemical pregnancy. So chemical pregnancy is when we do a blood test, beta hcg, there will be a rise in the beta hcg level. Maybe it will not double the second time, there might be a minimal more rise and it drops down. So the embryo doesn't form itself, there is no implantation, just she gets pregnant and you abort. So this is typically known as chemical pregnancy. Very commonly, people come to me saying, I just did an UPT, I we say as a gynec, I need to see a sonography, were you pregnant? Then they do a beta hcg and they say, no ma'am, I had done a blood test, but before I could do a scan, because to see a baby on a sonography, your beta hcg at least should be minimum 1500 to know the healthy embryo is there. So if your beta hcg is not more than 1500, you will not see the baby in the uterus. So you have to, if it is a chemical pregnancy, all right. So how do we go about the chemical pregnancy? Sometimes in polycystic ovaries, if there is a luteal phase defect, second way, what happens in that, the progesterone suddenly drops down. They have a lack of progesterone. So in these PCOS patients, if you see AMH is high, the periods are irregular, they sometimes even do not know they are pregnant. So they always think 2 months mein period aata hai, 3 months mein period aata hai, so I'm not bothered, or I don't need to go ahead and meet the gynac. But the problem is sometimes we see patients, they were already 2 months pregnant and they're bleeding because their progesterone level has dropped down drastically. So even a PCOS, any patient, I always tell them in PCOS also you can get pregnant. Out of the 12 months, suddenly 3 or 4 months are good where you ovulate naturally. You can have the higher chance of pregnancy. So whenever you miss, first do your urine test, urine for pregnancy test. If you're positive, go to meet a gynac, because they'll have to put you on some progesterone support that will help you out to carry the pregnancy longer. Remember, your body needs an extra progesterone only till 9 to 10 weeks, then the placenta takes over. So placenta makes sure that it holds on later. It's not your body which is going to give the progesterone. After 10 weeks, that's why we are not worried much about extra support system for the mother. So in a PCOS patient, remember, if if fasting insulin is high, you might have to put her on even metformin to make sure that there are history of abortions happens when there is increase in thyroid level. Increase in and thyroid is so common, suddenly in pregnancy it suddenly drastically increases, otherwise there is no increase. All throughout the pregnancy, it's normal, 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 and at second trimester or even at a 10th weeks, so you have to do a serum TSH in a patient, even though her TSH is normal, her thyroid profile is normal. So you might say that my thyroid, all throughout my, I never had thyroid, but in pregnancy I suddenly detected with thyroid. So that's also common. So if you have thyroid, it has to be very well under control. The TSH level should be less than 2.5, and that will make sure that your pregnancy will continue. If your sugars increase, again, there are chances of abortion. So you, as a PCOS or even a regular, you have to see your fasting, your PP, your HbA1c levels. If everything is good, is it under control? So these things have to be monitored. It's not, in pregnancy, like we hear gestational diabetes. What does that mean? During pregnancy you get diabetes. Pregnancy induced hypertension, during pregnancy you can get blood pressure. So these are the things which we always try to look out. We make sure that we do not miss out all this and have any problems or abortion rates increases in these cases. So remember, basics, it's just the basic. When the patient comes in, or even you, if you have a family history of thyroid or diabetes or you're a PCOS, these are the basic tests. Sometimes people feel that why are we doing so many tests? It's not required. First 3 months we don't need to do anything. No, we need to monitor and we need to figure out everything is fine. So first 3 months we get these blood work done. If everything is good, then we can go ahead, control and monitor that there is no other issues. Like I said, the other history will be of missed abortion continuously. Some people have 2 3 repetitive abortions, and when we do a good 3D sonography, you see a septum in the uterus. So when there is a septum, so the implantation of the embryo, there is no vascularity and they abort. So if there is a septum, we do a hysteroscopy. So even with a history of 2 or 3 abortions, we put a hysteroscope, that is a telescope inside the uterus, check the uterus is fine, clear out if there is any septum or a polyp, remove it, operate it, and then send the patient again, tell her to try conceiving. I had one patient who had a history of about 7 abortions. Every time she would come, and so I had seen her for the first time, and she was the 6th abortion over, and the 7th time she came when she was pregnant. I said, let me first investigate her. When I investigated her, she had hyperthyroidism, which was never, people didn't know about it, or they missed out, or they never did her thyroid. She had done all the tests from the higher end tests, but the basic thyroid was missing in hers. When I told her we might have to terminate, don't let it go into an abortion, let's terminate this pregnancy, get your thyroid in level under control, and the next time when she conceives, she has 2 healthy kids. So remember, you have to have patience. Sometimes when there is a history, let the doctor go through all the basic investigation. If everything is fine in basic, maybe they need an advanced testing, but you need to go check everything, handle everything out, and then let the patient conceive. Take 2 months, understand what might be the reason. So there's somebody written, are there any treatment to avoid miscarriage when the cause is known, and what is the success rate in such cases? Yes. So what happens when the cause is known, it's more simpler, because like I said, when I see a septum or I see a polyp, I know the chances of abortions are high. I see a hydrosalpinx, that is fluid in the tube. Septum is one small little growth inside the uterus. Polyp is like a endometrial tissue growing inside the cavity. So if I see all of this, I will make sure I clear this out before she conceives. So we decrease the chances of abortion. Like I said, if it's a PCOS patient, I make sure I put her on progesterone support. I make sure her sugar, thyroid is fine. We give her whatever supplements required prenatally. So we can always avoid any abortions. And if there are repetitive abortions, why we tell them sometimes that stop planning naturally. Maybe there is a problem in an embryo, so there wherein we go ahead with an IVF process in these cases, wherein we retrieve the eggs, find out what's the quality of the egg, check the quality of the sperm, create an embryo, a healthy embryo, and that embryo will be sent for a pre-genetic testing. We do a PGS, pre-genetic screening of the embryos, and if it's an healthy embryo, then only we transfer it back into the patient. So if there is no reason, like unexplained infertility, I kept doing all the tests, everything is fine, her karyotyping is fine, husband's karyotype is fine, she's gone through more than 4 abortions, there is no answer, everything look good, in that you have to go ahead for IVF. Is not done for fertility treatment because she conceives naturally. The thing is, we do an IVF to check whether the embryos are any abnormal or is there any problem in that embryo. We surely make sure only we transfer a healthy embryo into that lady. So once we transfer a healthy embryo, we have a higher chances of conceiving. So this is one commonly, when it's very tough for a patient to say, oh, after you go for 4 abortions, after a history of 4 abortions, then I will go ahead with this. No, you have to explain them these first. Try, make sure first to investigate her properly, completely. Husband and wife both have to be investigated. If they tell you that there is a history of consanguineous marriage, that is, you are related marriage, in that you have to do some more tests. And like I said, sometimes they need a pre-genetic screening of the embryos before transferring them. So you have to go step by step, find out the cause and treat according to the cause. So previously, nowadays, as you know, people don't marry early. People come only at 34, 35. And it's sometimes so shocking that some people marry at 35 and then they say, I want to plan my pregnancy, yet want to know my husband for 2 3 years. So the thing is, fertility is declining. We all have to understand that you cannot take that long, because we don't know if there's going to be any history of abortions or your pregnancy is going to go smoothly till 9 months. So every time when there is a history, when people come to me that I'm planning to get married, and if they're 35, I always tell them, take your time, maybe 6 months. After 6 months, let the nature, if you get pregnant by itself for try for a year. If it doesn't work out, you need to come back to us and start planning at the right time, get the eggs at the right quality, good embryos. So this is very important. Do not waste the time. Abortions can be managed. I have seen so many patients with 4 6 abortions, but they have conceived, they have a healthy embryo, a baby in their hand. Sometimes there's a history of one child, very healthy, delivered naturally, there was no problem in conceiving, it was natural, everything delivered naturally. And after that, there's a history of abortion. Every time she gets pregnant, she aborts within 2 months. The embryo is not healthy. So that is because sometimes they don't realize, maybe the first time when she delivered, she was 27. After that, even she doesn't try for another 8 9 years. The age, the quality of the eggs, the quality of the embryo, everything changes. So you have to know, if you are planning to, you need a sibling, you should plan at the right age. Everything changes, equality, your ability to carry on the pregnancy, everything will be difficult. So you have to plan it at the right time, at the right age. And even with the, like I said, abortions, you always send the products of conception. What is products of conception is, when you are pregnant, what is the, when the embryos which are left inside the uterus, we send it for testing. That's called the karyotyping of the POCs, we say it. Or we do the microarray just to figure out what was abnormal in the embryo. We need to know that. Someone is asking me what lifestyle changes we need to do after miscarriage. Basically, once you had a history of a miscarriage, I would say, what was your weight that time? Were you little overweight? You need to make sure you lose a little bit of pounds, make sure your thyroid, prolactin, everything is fine. You do not need to wait too long. If the history of abortions, the chances of getting pregnant is sooner, so you can just till you're emotionally stronger, maybe for 2 months you can hold on, and then go and plan for the next pregnancy. And like I said, more than lifestyle changes, you try to find out all the basic causes. Everything is fine, there's no issue in that, and then it's okay to plan again. So just hold on, talk to the gynec before you plan the second time. If you need to put on some prenatals, we put on folic acid, give you folic acid. Take some folic acid 2 months prior. Rule out, do a good 3D sonography to rule out any septum or polyp. Check his semen count, his DNA fragmentation, your AMH level. So if everything is good, after 2 months you can go start your pregnancy. What should I include in food to recover soon and become healthy? If see, it's a lot of emotional trauma more than physically. If you are underweight or anything, I don't know what's your BMI. If you're underweight, you need to keep your BMI approximately at 24 to 25. You eat healthy, doesn't matter. There's nothing like the food will cause, but yes, we call the superfoods like avocado, broccoli, pomegranates. These are healthy nutrition supplements, flax seeds. You can all include that in your food. But it's not even very thin and fragile people or even very obese people can carry the pregnancy healthy. So it's all about your mind. Keep your emotional support, emotion quotient, it should be very strong. You need any help, talk to the colleagues, talk to your friends, or there are these groups, support groups, where you can meet. Because at the end, like I said, I know it's a very traumatizing on the mind. It's not a simple game for a patient. It's very easy for on the other side to talk, but when a person and a patient is going through it, it's very tough for them. So it's, you need any help, you can go to a counselor, talk to them. But there is not a reason that it's second time you're going to again have an abortion. Remember, have a vision, think positive. If everything is fine, you are going to continue the pregnancy. So it's not about diet or exercise. You can do your brisk, not brisk strolls, walking 20 minutes of, go to a garden, park, go take your own fresh air, eat healthy, the green leafy vegetables more than packed foods. Avoid the burgers, pastas. Do not eat any fermented food. That's it. And I'm sure there's going to be no problem with carrying your pregnancy for all the till term. So it doesn't matter. So remember, but like I said, so the abortions are the first trimester and second trimester. First trimester is between till 12 weeks, and after that goes from 13 to 24 weeks. So when the first trimester, most common, like I said, can be chromosomal problems, like the abnormalities in one of the chromosomes in the male or the female partner, or just an random abnormality in an embryo which will fall off itself. Or she's completely threatened abortion, that is, she's bleeding again and again. Sometimes because she bleeds, we try to stop the bleeding, give her some support, and sometimes that causes infection, so we need to give her even progesterone support and an antibiotic course in the first trimester, that is in till 12 weeks. After 12 weeks, the most common abortions are because the uterus is weak, it cannot carry the pregnancy. So what, the patient suddenly comes up and says that, oh my, I just had a bag of water burst at a 14 or a 15 weeks or even a 17 week. We cannot save that child. At least you have to cross 26 weeks to have an if they deliver by 26 weeks, we can save the child in an NICU. But before that, we call it an abortion. So the second trimester, most common is uterus related, some uterine infection, vaginal infection, or suddenly the cervix opened up and she went into preterm labor. So these, what is the cause? So sometimes if we need to know whether the cervix is very open, very easily open, so we put in a dilator and just check whether, without anything, whether the dilator is going at a number 6 or number 8, and we know. So we can tie the cervix beforehand. We make sure that we tie the cervix, let the cervix be closed when she conceives. So we can even, it's not needed an os tightening, we can do even before she gets pregnant. Previously we used to do the os tightening only once she's pregnant, but we can before she plans a pregnancy, we can do an os tightening but in that case also, it's not that you've tied the cervix so she's not going to go into labor. Chances of infection, or even if the uterus is very weak, so we tell you to rest it out. If you cross even 28 weeks, you're done. You have with beautiful NICUs in India. We are so lucky that you can the babies have gone home. I had one delivered a 26 weeker, hardly 600 grammer, and now she's 10, 11 years old and she comes to see me. It's such a beautiful feeling, that it's not necessary. Like, we are at such a good, powerful NICU backup, and we have everything in India that can make sure we can save the life of the child. We need to give some steroids to make sure her lungs are mature before that. But all that is taken care. If you know you had a history of second trimester, that is after 12 weeks you're having a history of abortions, you need to make sure that is the cervix incompetent, or take a cervical stitch. Sometimes people cannot carry twins if they have a family history of twins. When the twins are in the uterus, it's very tough to hold on that big pressure, the weight of the baby. Some mothers are smaller, they cannot carry them. So in that case also, you need to tell them to rest. As a fertility specialist, we have many twins. Okay, and when we do tell them to carry on, and we do not take a cervical stitch, and our patients have crossed 34, 35 weeks. So you have to explain them how, keep the vaginal hygiene. If there is any discharge, treat it before time. You have to make sure that do not use too much of pressure for, while passing stools and all. Explain them to rest, and rest well, they will continue their pregnancy longer. So these are few things which you have to make sure all the females, when they get pregnant, these are the important things about the vaginal cleanliness, avoiding infection. With all these process, she's going to have a good healthy pregnancy. And like she asked me about the diet, yes, always give them good healthy nutritious diet. If she's a vegetarian, non-vegetarian, remember, not too much of quantity. Always in small quantities you can eat in pregnancy, because your stomach, when the uterus is pushing up, the stomachs get compressed, and you need to eat maybe too early before the acid secretion increases. Too early, small meals, that will also help not having acidity and nausea, vomiting during pregnancy. So make sure she eats too early, eat healthy food, avoid getting juices from outside. We don't know what water they use for cleaning and all. Typhoid, jaundice is very high in these cases. So in that, what you have to do is get fruits, eat, open up, peel up an orange and eat an orange instead of making an orange juice. So you need to make sure you eat healthy, eat nutritious food. And about the abortion part, like I explained to you, there are all the reasons how you can continue your pregnancy. You do not need to worry about because of the first abortion, will I have the second? My friend went through 3 abortions, so even will I go through 3? Always have a positive vision, it's not necessary. Sometimes my first abortion was Downs, and the recurrence rate is 50, 12%, 12.5%. Will I have the second one again? It doesn't matter. Stress cannot be the cause of miscarriage. No, stress is not a major cause at all of miscarriage. Like I said, there has to be a cause. The cause will be some anatomical cause in the uterus, or some genetical cause, or some infectious. So we have to figure out, or some autoimmune disorder. Like sometimes when somebody has an APLA syndrome, wherein it's called antiphospholipid antibody syndrome, wherein what happens, the body rejects, it feels that the embryo, the baby which is forming, it's an outsider, and it rejects, and you abort it. So the patient keeps having a history of abortion in these conditions. So what do? We give them steroids, we give them medicine. We have to put them on some medicines and a blood thinner to continue the pregnancy. But we continue that till approximately 25, 28 weeks, or even till delivery. For 72 hours before delivery, I stopped the heparin. So if these, what is the cause, like I said, we need to find out. We can treat it exactly, and make sure that she does not continue have the cause of abortions again and again. And if in karyotyping, if we find out something is there in male, so what do? We do a pre-genetic, like we said, a PGD, PGTA. So what are these things? We do pre-genetic screening of the embryo. So, and if the father or mother is having a specific disorder, we make sure that does not pass on to the child. If that embryo has that, we do not transfer that. Like thalassemias, if the sister is suffering from thalassemia, you see, it's not easy for a mother to see one child suffering and a second one. So they come to us saying that I want to make sure that my child does not have thalassemia. In these conditions, what do is we take a biopsy from the embryo. We test it whether there is any thalassemia in that baby. If it is there, we just do not transfer those embryos into her, and we avoid getting that embryo passed out the thalassemia to the child. So the nowadays, with all Duchenne muscular dystrophy, which you hear so much, people, it's not an easy disorder. The medicines go on in corrodes. So this also can be diagnosed. So if one child is suffering, and there was an abnormality in that child, you can do a pre-genetics test and screening, and make sure this baby is not going to have anything, and then transfer a healthy embryo. So sometimes you need to go ahead with the pre-genetic testing and IVF in history of abortions. What happens to my baby during a miscarriage? So what happens is, so it's depends upon what trimester miscarriage. If the baby is at fifth, like I said, chemical, like a 5 weeks, maybe the heartbeat is not formed, it's a blighted ovum, so just a sac forms. And because there was some abnormality in the embryo, there is no other growth, so there is just a sac, there is no embryo. If after a 7th, 8th week you see a embryo, you see the baby and you see a heartbeat is formed, and suddenly the heartbeat stops, so the growth of the embryo shrinks, so there is nothing, and we have to remove the baby out of the uterus. Sometimes it just complete, it's called complete abortion. So when that is there, you bleed and the baby just falls off, the embryo just comes out and the uterus is cleared. Sometimes half is inside, we go ahead, clean the uterus, we remove it, make sure that, because that can cause infection to the mother if it stays inside, because it's already a dead tissue which does not have any embryo, there is no heartbeat, there is no baby growing in, that can cause infection to the mother and will have problems in the second pregnancy. So if there is an history, you know it's confirmed abortion, you need to go in, clear the uterus, take good treatment, clear, give antibiotic cover, and nothing, so there is nothing happens to the baby actually. And the body, okay, what changes happens in my body after miscarriage? What happens in the body, there is no changes. What, when the uterus is growing, when you're pregnant, so the uterus has started growing, but when you missed abort at an earlier stage, so uterus is hardly maybe 7 8 weeks, so it's still a pelvic organ, so you do not, your body does not go through many drastic changes. It only goes through drastic changes in the second trimester. If you're, you have an abortion at a fourth fifth month, so already the breast buds, the breast changes are happening, the milk production is starting. So within the first 3 months, there are not much changes in the body, there is nothing, you don't have to worry about that, there is, you do not see any difference, and you are back to normal. Sometimes, we tell the patients that after, you have curated and she's clear everything, we tell them to go back and start working from the next day itself, then mentally and physically she is busy. She needs to be mentally fine, and she needs to make sure that, she doesn't get into that thought process, and she should be comfortable, positive, that yes, you're going to have a healthy child. And that's very common. You do not have to, go through that, one, like I said, one abortion means second abortion hone wala hai. Nothing like that. You are going to have a healthy child the second time, or the even after two abortions, third time. Like I said, I've seen six abortions and they've had a healthy baby, and after that they always conceived and they got the easily pregnant, continued for 9 months, whatever was the cause treated, or sometimes there was no cause found. After 4 5 abortions, suddenly now they get continuously pregnant and everything goes well. So there is nothing to be worried, but always find out what was the cause, what is the reason, treat it accordingly. So I hope everybody gets, this lecture was helpful to everybody. And so I would like to conclude. And let's, anybody has any more questions or anything, you can put it up on the chat, or you can come contact Apollo Fertility, Navi Mumbai. Thank you all. Thank you.
Thank you so much, ma'am.